Abibi, you see, for years, conversation about Africans' challenges have centered around history, slavery, colonization, and neo-colonization. But today, there is another crisis that is quietly affecting millions of lives in Africa every single day, and that's the healthcare access crisis. When you look at it, across Africa, millions of people struggle not because treatment does not exist, but because access to these treatments remain out of reach. The barriers are many, and unless we decide to address them ourselves, good health will remain a privilege rather than a right. So today, I want to discuss our 5 major barriers that are preventing Africans from accessing quality healthcare and why solving them matters. And the first barrier we'll be looking at is the workforce shortage. Woof. Every year, there is an exodus of skilled professionals leaving our continent every day. Let's take Nigeria as a case study, of course, because I'm a Nigerian. Every year, Nigerian medical schools graduate thousands of doctors. Yet, many leave the country within the first few years of qualifying. Why? For better working condition, better pay, better equipment, better opportunities. You see, the ripple effect of this is that the healthcare workforce continues to shrink precisely even when the demand is growing. According to a figure that was reported by the Medical and Dental Council of Nigeria, the MDCN, more than 130,000 doctors have registered overtime, yet only about 58,000 renew their licenses, with roughly 55,000 actively practicing. That's for a country with over 200 million population. That number is alarming. But see, the challenge becomes even clearer when it is compared internationally. Nigeria has approximately 0.4 doctors per 1,000 people, compared to the UK that has 3.2 and the United States that has approximately around 2.6 per 1,000 patients. And even those numbers don't even tell us the whole story, because the problem is not just about the numbers of doctors that are left in the country, but the distribution of them across the country. Take, for instance, a woman in Lagos has more healthcare options compared to her fellow counterparts in Zamfara, who has fewer healthcare options. This is really sad. The second barrier that we are dealing with is affordability. And this barrier often strikes when people are most vulnerable. Across much of sub-Saharan Africa, healthcare is largely financed through out-of-pocket spending, meaning patients pay for these things themselves. In practical terms, this means that many patients must pay before they receive care, including government-owned health facilities. I mean, a mother requiring a cesarean section must first pay for the surgery before she's attended to. A patient with chest pain must have paid for consultation separately, paid for lab investigation separately, and then there is the treatment. Or let's look at a child with malaria that does not have money. The parent must first get the money for testing and then medication before treatment can even begin. So when healthcare becomes a cash and carry system, people delay in seeking care. See, not because they do not value their health, but because they can't afford the first step. And by the time they can, manageable condition may have become life-threatening emergencies. So let's look at the third barrier, which is distance and infrastructure. See, even when the patient has money and they know where to go, reaching healthcare service can be extremely difficult. I'm talking poor roads, long travel times, limited transportation. The list is endless. See, many healthcare facilities struggles with unreliable electricity. Even though there have been different bans, yes, this continue. Inadequate water supply, shortage of medical equipment, and inconsistent availability of essential medicines. Of course, healthcare does not exist in isolation, right? So it also depends on infrastructures. And when infrastructure fails, healthcare suffers. Let's look at the fourth barrier, and that's trust. I think this is perhaps the most overlooked challenge when we talk about challenges in healthcare. See, when patients feel ignored or disrespected, misdiagnosed, or exploited, one thing it does is that it breaks the doctor to patient trust. And when this trust is broken, they seek alternative. What do? They turn to community for advice, traditional healers for treatment, religious leaders for prayers, social medias for information, family network for referral. So the list is endless. This is not simply a matter of ignorance, actually. It's often a response to the negative experience within the healthcare system. When accurate health information is unavailable, inaccessible, or difficult to understand, misinformation quickly fills the vacuum, and misinformation, we all know, can be deadly. So let's look at the fifth barrier, and that is what I call the specialist search problem. Imagine a resident in Lagos that was diagnosed with end-stage renal failure and needs a nephrologist, that's a kidney specialist. Where do you want her to start from? Or where do we want her to start from? There is no comprehensive verified directory, no simple way to compare specialists, no easy way to know which hospital have the services she needs, and there is no trusted platform showing her whether the specialists are accepting patients or not. So what most patients do in this case is that they rely on word of mouth. They ask friends, they ask relatives, they search online, and sometimes they even find outdated information, and out of frustration, they rely on word of mouth and they make decisions based on hope, not certainty. You see, patients frequently end up at facilities that are not well equipped for their condition. You see them, they spend money, time, energy navigating a fragmented system. And oftentimes, valuable time is lost, mismanagement occurs, late referral happens, and even avoidable death becomes the news of the day. See, this is the gap we are closing with Cliniconlineplus. Cliniconlineplus is more than a healthcare platform. It's a trusted intermediary, a bridge connecting patients to the right healthcare and provider. On one side, there are millions of patients searching for verified doctors, specialists, hospitals, and even diagnosis centers, right? And on the other side are qualified healthcare professionals and institutions providing excellent care but lacking a trusted digital platform through which the right patient can find them. Oh, and behold, there is Cliniconline sitting between these two groups and makes those connections faster and easier and even more reliable. So our goal is very simple with Cliniconlineplus, and that's to help patients to find the right healthcare professional at the right time. We are also providing assistance to healthcare providers to become more visible and accessible to their patients, and ultimately to make healthcare navigation across Africa as simple as finding your destination on the map. Because healthcare should not depend on luck. If you believe healthcare access in Africa can get better, please join our community and follow our journey. I want you to click on the link below this video and sign up. Let's get started and let's do wonders on this journey. Thank you. I love you. You're real.